I mean, generally, I don't. There is a mistrust in Kuwait. We know that there's a mistrust in Kuwait for doctors and for medicine. I blame WhatsApp for
Okay.
90% of
Yeah.
it. Have you faced this issue?
There's a misunderstanding and lack of awareness, or yeah, as you said, some messages that get out, the wrong messages. So there's always in a small minority that happens, and I remember that especially when I was an intern, because if they don't see the consultant early enough, they're worried. They're like,
Yeah, yeah.
"What's happening? Are you just going to practice on me?" and stuff like that.
Yeah.
So it's important to try to send the message out clearly, and answer any questions. And so that's how I would try to overcome it. Doesn't always work. If it doesn't work, I would inform my senior for advice and so on. But definitely there's some mistrust, especially the vision of the country is not clear. So a lot of people who are sick get sent abroad and so on.
That's true, yeah.
So people are like, why do I need to be sent abroad? Is it because the healthcare system is not good? To the contrary, I'm sure we have some deficiencies.
Yeah, of course.
But
Naturally, like any other
just
place.
like any other place, it's a
Yeah.
learning curve. So yeah.
Yeah. That's interesting that the messaging about the country, to the country people, it's unclear, because it's true. We send all of our graduates go to Canada, to the States, and even in Kuwait, and even our boards are being slowly getting recognized.
Accredited by the Canadians and
Exactly.
others, yeah. And so we're trying to have the foundation.
Yeah.
It's just, I think mixed signals are being sent.
Right. Right.
And I don't blame the public sometimes for the mistrust. Yeah.
Yeah.
Yeah. But I think with some education and programs like these,
Hopefully.
podcasts like these, the message will get sent out.
That's what I just wanted to ask is how do we counteract, because we have misinformation going on WhatsApp and just from conversation, which again is natural. This is not necessarily an abnormal thing. How do we counter?
I think we should just continue the conversation, continue talking, continue to educate. Don't dismiss the patients. Don't dismiss their concerns. If it was me, I would be anxious as well. So
I mean, getting put to sleep is it's scary.
It's kind of scary. Yeah.
Actually, okay, this is kind of a weird question.
No. Have I?
No, I have a weird question for
yeah,
you. This is a really weird question. Psychologically,
yes.
Was it not crazy for you to kind of just see, like, I'm basically taking this human being, I don't want to say you're making them dead, but you know what I mean?
I'm putting them in a coma.
There we go.
Yeah,
Yes.
like literally in a coma. Yeah.
I remember, like, for me, the first time in med school, like in the anatomy lab, the first time I remember it was, I leaned back and I just felt a cadaver's foot on me. And my heart skipped a beat and I went, oh, wait, this is the only place in the world where this is okay. This is normal.
Yes.
Psychologically, was that an experience for you to kind of
we
be
would get like with colleagues, we always get like abused for we are the doctors with the drugs, with the, with the good stuff, whatever they say.
Yeah.
We don't generally abuse them, but it's actually a huge responsibility. Taking someone and putting them into literally a coma. A controlled coma. It's a huge responsibility. That's why anesthesia has always been associated with safety. So the practice of anesthesia is always safety has always been the number one thing in anesthesia. That's why we're always compared to pilots, because we always have a set of protocols to follow whenever something doesn't go well.
Right.
And we depend a lot on machines, ventilators. So yes, it is kind of psychologically scary or weird, but all physicians have a responsibility for safety, but it's just a different way. Surgeons cuts people open, literally, and I'm taking a small different part, but it just adds more weight and makes you thankful that someone trusted you to do that.
Yeah, of course. Now, circling back to, we talked about kind of what it looks like for you in the hospital.
Yes.
Now, clinic-wise, what do your clinics look like?
Okay, so in general, in anesthesiology, most of the time is spent in the operating room. However, anesthesia, I would say, does not start in the operating room. It starts outside of the operating room in the pre-op clinic, or the in other countries they call it the pre-admission clinic.
Right.
So this is where you optimize your patients for the upcoming surgery.
Right.
Make sure everything is accurate.
Right.
In my practice, because I have a pain degree, I also have a pain clinic.
Right.
Where I see different kind of patients with pain, chronic post-surgical pain, cancer pain, neuropathic pain, and like lumbar disc pain and peripheral joints.
Mm-hmm.
So I do that on Tuesdays in Jabr and Wednesdays Bilamiri, and it's a totally different dynamic. Because as an anesthesiologist, you usually see the patient once, maybe see them in the OR, unless it's a recurrent surgery. This is more chronicity. You see the patient regularly,
chronic
give them
pain
medication.
Yeah.
You might do a procedure. So that's a pain clinic.
Actually, talking about pain clinics, I never truly appreciated the role of pain management until my father, God rest his soul, he had cancer.
Yes,
and the pain. I think he visited you.
Someone asked me, but he was with also another good pain physician.
Right.
Continue. Sorry.
Yeah. Sorry. It's just that was when I truly understood the role of pain management.
We shared a very similar story. So my dad was diagnosed with metastatic cancer during my last year of anesthesia residency.
So very similar stories, right? Yes.
Yeah, and I saw how much the pain, and that year I was applying to the pain management, to the pain residency program, and I got accepted actually at his last 2 weeks or last 4 weeks, and it was very happy. But anyway, I saw how much the pain management changed his behavior, his attitude with us, and how happy he was of the outcome. So despite all the anxiety, depression that comes with it, and the suffering, but that changed my perspective completely. Initially, I just wanted to do the pain residency program because I wanted to do procedures.
Right.
But now I'm more interested in cancer pain.